Secretary please call the roll?
Director Curry?
Present.
Vice Chair Deere?
Deere is here.
Director Garza?
Present.
Director Guggenheim?
Present.
Director Harrington?
Present.
Director Kim?
Present.
Director Ketting?
Present.
Director Munar?
Present.
Director Prendergast?
Present.
Director Ryder?
Ryder is here.
Director Story?
Present.
And Chair Taylor.
Present.
You have a quorum.
Thank you. Pursuant to the Illinois Opens Meeting Act, meetings held remotely will require roll call votes for all action items. To streamline, we will combine the action items into a combined motion. Meetings of the CCH Board and its committees will be held remotely until otherwise noticed due to the determination that a public health emergency exists. The next regular meeting of the board will be held Friday, March 25th at 9 a.m. The first item on today's agenda is employee recognition, which will be reviewed by Mr. Rocha. We will also have a board resolutions honoring 2 exceptional and respected employees. Mr. Rocha?
Good morning, members of the board. I'm going to start with the recognitions a little bit out of order from how they're laid out in our report. I first want to start by recognizing the Cook County Department of Public Health for their recently achieved recertification, actually I take that back, as our local health department by the state of Illinois. CCDPH's Community Needs Assessment and Health Plan was also approved as part of the certification. As a certified local health department, CCDPH serves as a public health authority for suburban Cook County. CCDPH strives to prevent the spread of communicable diseases, enforce public health laws and regulations, analyze health data, address emerging health threats, and promote the overall health and well-being of our communities. Really want to take a moment and congratulate the entire CCDPH team for this achievement, for their hard work, and for their ever-going support of our community and our health and well-being. Congratulations to the Cook County Department of Public Health. Next, for some very special employee recognitions, I'm pleased to recognize Dr. Claudia Fegan, our Chief Medical Officer. Dr. Fegan?
Good morning. Thank you very much. I understand, Chair Linden, Chair Taylor, I appreciate the opportunity to summarize these resolutions. It is a honor and a privilege. I want to start with Dr. Matthew. Between these 2 physicians, we are recognizing more than 50 years of service to Cook County Health. Dr. Matthew came to Cook County Health in 2000. She came with a commitment to serve the underserved, as she had experienced service from Cook County Health and her family. And she points out that there is no greater way to understand and appreciation for those who have no other choice than to come to Cook County Health when you're unable to go anywhere else, and had a long-term commitment to bringing service to the underserved. She brought compassion, understanding, and a commitment to health equity. She has served a distinguished career here, and she has been a profound mentor. She served as the program director for our internal medicine residency program from 2008 to 2016, and she encouraged women to assume roles in leadership. I was very proud and felt privileged to name her as the chair of medicine in 2015, and she has distinguished herself providing leadership across the health system. She was the first chair in the health system to really take on the role as a system lead, immediately establishing herself at Provident and not just remaining at Strozier, providing leadership to the physicians throughout the health system. And she has represented us well. She has earned the admiration of her peers. She's well regarded by all of the chairs. She has been on the national stage and represents Cook County Health well. She was first woman to be the governor of the American College of Physicians for Northern Illinois. She now serves as a regent for the American College of Physicians, and I assume she will go further in leadership within that organization. She has also served as a senior advisor for the American Medical Association. She has been so well respected and acknowledged by her department that they gave a very touching tribute to her last night. So with more than 20 years of service, we know that Dr. Matthew will only do more and greater things. And as we tried to tell her last night, she will always be a county doc. And we are quite proud of the service that she has provided to the organization. There are literally thousands of physicians whose lives have been touched by her mentoring and who have become stellar leaders themselves. She encourages women to lean in, and it is really with great pleasure that we accept this resolution on behalf of Dr. Matthew. So thank you very much. Next, I would like to refer to the resolution for Dr. Connie Mannella. Dr. Mannella had come to the health system in 1991. She developed a passion for, she was exposed to correctional health when she did a rotation in medical school at Cook County Jail. And for the past 30 years, she has been a tireless advocate for the population that we serve there, recognizing that these patients are the most vulnerable and need not only good medical care, but powerful advocacy. She has provided exceptional leadership and has served at the jail continuously, except for a brief period in 2007 when we lost our wisdom and she was terminated, given less than an hour to clean out her office and escorted out by the sheriffs when we decided that the leadership at CERMAC was not acceptable. Thankfully for us, Dr. Mannella remained committed to the population, and when wisdom returned, she was returned not only to CERMAC, but then asked to be the lead physician there, where she has served as the chair of correctional health, earned the respect and admiration of not just the sheriff's office, but also the judges. And I've had the pleasure of sitting in court, in federal court, where judges defer to Dr. Mannella's wisdom. She has dedicated her life to the health of the population she served. She has, during the pandemic, established procedures that have earned the recognition of the Centers for Disease Control as a best practice in terms of being able to control the spread of COVID among detained population. She is recognized nationally as a leader in correctional health for establishing practices that have been beneficial long before the pandemic in dealing with infectious diseases in the jail population. Her efforts have been recognized. She earned the 34th Human Rights Award from National Alliance Against Racist and Political Repression. And that was in 2018. In 2017, she received the Doctor of the Year Award voted by the staff of Cook County Health. I had the pleasure in 2018 of giving her the Health Award from Health and Medicine Policy Research Group, all recognizing someone who has spent her life and made an impact on countless individuals. We will miss her dearly. She is a giant among physicians who have served this population, and she has dedicated herself to the well-being of not just the patients she served, but the staff she worked with. So it is an honor and pleasure, a privilege indeed, to also recognize Dr. Mannella, who will be taking a well-deserved retirement. Thank you.
And Chairman, just on behalf of everyone here at Cook County Health, I want to really recognize both those amazing leaders. Dr. Matthew has done an extraordinary job, as Dr. Fegan said, mentoring the lives of so many through the residency programs, but also through creating some exceptional programs in cardiology, pulmonology, our general hospital service line, and helping to make sure that we have some of the best centers of excellence around the country to serve the patients here at Cook County Health. We thank her for her tireless leadership and for the innovation she has brought to our system and to our organization, as well as her efforts to make sure that we continually do better and improve to set a new standard in medicine. For Dr. Mannella has done an incredible job innovating the space for justice-involved patients in CIRMAC and our correctional health facilities. Her work to not only be able to provide general medicine and overall wellness, but also to work on expanding mental health services, integration, and innovation throughout our justice-involved patient community has been extraordinary. She leaves behind her a team that she mentored and helped to create amazing work, and I think that there are not enough words that I can put forward that would truly recognize and capture the efforts, innovation, and work that Dr. Mannella has brought forward to our organization. Both these individuals are perfect examples of the extreme work, passion, loyalty, and commitment that we have here at Cook County Health, and it is a legacy, each over 20 years of well-served devotion and service to our community and to Cook County Health and our patients. And on behalf of our entire organization, we recognize them both, know that they will continue to be beacons of what it means to be part of the Cook County Health family no matter where they go, as once you're a family member, you are always a family member, and thank them for their service.
Thank you. I'd like to add my sincere thanks and gratitude, as well as a resolution highlights for the board to both Dr. Mannella and Dr. Matthew. We really, really appreciate your service, your commitment, your dedication, and wish you only the best in the next phase. The next item we have
Mr.
is...
Chair,
Yes,
Mr.
Chairman.
Chair,
Yes.
I would also like to thank both of the wonderful doctors for a job well done. I know that we at the county board lifted them up in the last meeting, but they have been extraordinary over the years. And I want to say again, on behalf of all of my colleagues at the Cook County Board and even here at the hospital board, we want to just give you our sincere thanks. We appreciate you. I yield back.
Thank you, sir, very much. We appreciate it. Well,
so much.
And Chairman, as both the physicians are with us.
That'd be great. Yes. Why don't we start? Dr. Mannella, maybe to start.
Thank you so much. I appreciate the recognition, and of course, it's been an honor and a privilege to serve this population. Most importantly, it's been an honor and privilege to be part of Cook County Health and the mission. And Dr. Fegan, thank you so much for your leadership. As we know, when there is a time when the jail was not supported, we saw what happened, and I could only have accomplished what I did because we had the unbelievable leadership of Cook County Health, the Cook County Board, and I think I'm just so proud of the team that we developed. I know the mission will continue, and I know the support will continue, and it gives me such peace, and I just can't thank everybody enough. And I wish you well, Dr. Matthew, because Dr. Matthew's team obviously was also involved with taking care of our population. Thank you so much.
Thank you. We really appreciate it. Dr. Matthew, do you have any comments or words?
Thank you, Chair. I'm so honored to be recognized by this group. I sincerely thank you. As Dr. Fegan said earlier, I came here many years before I ever became a doctor. I was a patient here. My father was a patient here. So the profound privilege to lead in an organization that cared for and saved my father's life has helped me stay connected to him for, all these years, 25 years after his death. So being here, surrounded by this mission and these individuals that have walked this journey with has just been the greatest honor of my life. I will always be a county doctor, even when I'm not. And I thank you. Thank you for this time.
Well, thank you as well. Thank you both. We really, really, really appreciate it. And quite frankly, for reminding us of our mission and why we're here to serve the underserved. So thank you again. Mr. Rocha, do we have anything further?
No, that concludes our employee recognitions. Thank you, sir.
Thank you very much, sir. The next item is public testimony. Madam Secretary, do we have any written testimony that was submitted to be read into the record?
Yes, we received two statements. The first statement is from Diane Palmer, President of SEIU Local 73. Chairman Taylor and distinguished members of the Cook County Health Board of Directors, I am speaking on behalf of the 2,500 union members of SEIU Local 73 employed in various elected offices throughout Cook County who have worked throughout the ongoing pandemic. In 2020, the federal government provided Cook County with a funding which allowed 80 hours of paid leave time to be utilized in the event an employee or someone in their household tested positive for COVID and needed to quarantine. This funding was provided to prevent the spreading of this deadly virus and to protect the public. While these 80 hours were extended in 2021, it has not been extended for 2022. We have members who have contracted COVID on multiple occasions. Our members use this time for themselves or to care for their children, their spouses, and in many cases, their elderly parents. We call on you to urge Cook County Commissioners to pass a resolution that the 80 COVID hours will replenish every fiscal year on December 1st, retroactive to December 1st, 2021, for all union employees to come out of federal dollars provided to Cook County for COVID-19 purposes. This resolution is in the interest of protecting the public as a whole and discouraging employees from coming to work while sick. Thank you. And the next testimony is from Joyce Ball. My name is Joyce Ball, and I am a registered nurse in the emergency department at Providence Hospital. I am here on behalf of the CCHHS registered nurses. Cook County Health is requesting an additional $64.1 million in funding for agency nursing contracts, which costs county taxpayers more money than retaining staff nurses. CCHHS nurses continue carrying the hospital system's patients safely through the ongoing pandemic. CCHHS has done nothing to retain staff and is hemorrhaging RNs. NNOC last met with CCHHS January 11th. County has intentionally delayed responding with counterproposals for staff retention. We demand to meet immediately and for the county to release their counterproposals to NNOC. And that concludes the public testimony.
Thank you. The next item on the agenda are the board and committee reports. The minutes of the colleagues, we ask that you mute yourselves. Not speaking. Thank you. The next item, the minutes of the January 28th board meeting are being presented for your review and approval. Approval will take place in the combined motion later in the meeting. Are there any corrections or revisions to be made to the minutes? Hearing none. Next, Director Pendergrass will review the HR committee meeting minutes.
Thank you, Chair Taylor. Good morning, everyone. The Human Resources Committee met on Thursday, February 17th at 12 noon. The next regular meeting of the Human Resources Committee will be held on Thursday, May 19th at 12 noon. Note, we are not planning to have staff re-review reports from the meeting. If any additional questions are raised regarding the presentation or metrics contained within the minutes, staff will be present and ready to address. The reports that were received and are included within the minutes, we had a report from our Chief Human Resources Officer, Ms. Valerie Amos, included the following information on these subjects: the HR functions, the FY21 overview, FY22 initiatives, recruitment and selection, HR operations, employee engagement, training, workforce development, and FY22 metrics. There were 2 follow-up questions. The first regarding employee engagement and Thankful Thursday events. A calendar of those events will be shared at a future meeting with the board. The second follow-up was a request for regular metrics to be presented in the area of recruitment and on turnover in order to look more closely at what is driving that number. And that information will also be coming forth in future meetings. The employment plan officer also presented the semi-annual report. There were 2 action items: the CBA with the International Union of Operating Engineers, AFL-CIO Local 399, and the CBA with the House Staff Association of Cook County, representing all postgraduate level physicians and dentists, interns, residents, and fellows. These were fully reviewed by the committee in a closed meeting and were recommended for approval by the committee. The CBA materials will not be re-reviewed today, but if any directors have questions on the CBAs, we will hold off approving the minutes until the questions are addressed in closed session later this morning. Otherwise, if there are no questions on the CBAs, the minutes are being presented for approval to be included in the combined motion that will be made a little later in the meeting. Upon approval of those minutes, that confers board approval of the CBAs contained within the minutes. Please hold for the combined motion or after closed session if there are any questions on the CBAs. And that concludes the report that I have. Are there any questions from any of the directors? Seeing no hands and hearing no voices, I will turn it back over to you, Chair Taylor. Thank you.
Director Pendergrass. We appreciate it. Next, Director Munar will review the Managed Care Committee committee metrics with Aaron Galena, Interim CEO of Health Plan Services. The committee did not meet this month, so those metrics are being presented directly to the board. Additionally, it was requested that Dr. Yvonne Collins, Chief Medical Officer of County Care, provide an overview of the health equity update that she presented at the January Managed Care Committee meeting to the board. So that presentation will follow the metrics.
Thank you. Thank you, Chair. I will turn it over to Mr. Galena, Interim CEO of the Health Plan, to review the metrics.
Good morning, directors. We will start this morning with our usual membership slide. So we've continued to see growth within the health plan month over month. Growth was a little slower in January than what we've seen. So we've been growing between 3,000 to 4,000 members per month. January had a little less growth, and that mostly seems to be driven by just less new enrollees coming into Medicaid in January. February looks like we're returning to our usual trend of 3,000 to 4,000. So we'll continue to monitor that. Members impaneled to our Cook County Health Clinics also continues to grow proportionally and is just shy of 45,000 members. The next slide shows the overall Medicaid managed care market, and this data is through December of 2021. So County Care continues to increase in market share, up now to 32.3%. And then the rest of the market has remained relatively stable throughout the recent period. The next slide shows that growth of County Care compared to the overall Cook County Medicaid managed care market. So you can see over the past 12 months, the overall Cook County Medicaid managed care market has grown about 6% compared to County Care's overall enrollment increase of approximately 11%. The next slide shows our membership compared to our budget. You see the new budget in the blue bars starting in December of 21 for our FY22 budget. And you'll note, membership was tracking with budget very closely in December and January. We had anticipated in the budget that redetermination would start back up in January to February. So that's why the budget assumed a decline, which you see in the blue bars. Redetermination continues to be suspended, and as a result, our February membership is starting to significantly exceed budget similar to last year. The next slide shows our operations metrics, which are remaining steady and within SLAs. And then our next slide shows our overall admissions per thousand. And red bars here are prior period. The blue bars are current year, current period. And you can see that in the blue that we continue to see lower utilization this year compared to last year. So we're seeing a good trend in terms of overall utilization. One note, the light blue that you see on the screen is projections. So using our authorization and incurred but not reported estimates from our actuaries to project forward. So we'll continue to monitor how that turns out in actuality, but this is our current trend projecting. The next slide shows our overall vaccination rates. So we're up to about 48% with at least one dose of vaccine. We're continuing to see this increase a percentage or two each week. So we see several thousand members each week that continue to get vaccinated. This data is as of 2/4, and so we've now crossed the 50% threshold as of this week. Our next slide shows claims payment timing. So as you recall, we had an uptick in timing at the end of the county's fiscal year as the systems and the new budget was loaded and rolled over. But as expected, claims payment has started to catch back up over the course of January and February. So we're getting very close to that 30-day mark again and expect to hit that in our February data. And then the final slide just shows similar information on claims payment timing, but breaks it down by 30, 60, and 90-day categories. Again, especially in the 30 to 60-day category, you see the uptick at the end of last year and then the significant progress we've made in the early part of this year. And with that, I'm happy to answer any questions.
Thank you, Mr. Galiner. Any questions from the board?
It looks like Director
Harrington.
It's not a question as much as an observation. It's about the vaccination rates. And what I'm assuming that our rates might be higher, but we serve a population as representative of the communities that are most impacted by COVID-19. So what I really want to do is commend Cook County Health for their continued efforts to get everyone fully vaccinated moving forward. It does seem like the numbers are trending down. However, I think we must all remember that COVID is not going anywhere, and there could be an uptick at any time, and we all have to be safe, and vaccination is the best way to do it.
Thank you, Director. Unless there are any other questions, we'll turn to our next presentation. Dr. Collins, thanks for joining us today. We were so excited at the Managed Care Committee to receive your presentation last month on data-informed strategies to pursue health equity in the health plan. And we're excited for you to share it again to the rest of the board.
Good morning. Thank you very much for the opportunity. We are just as excited. And today is just a snippet of what we've done in the health plan. We'll review some very baseline data that we have gathered for our members in the health plan. We'll discuss some of our equity initiatives around our Hfs Pillars. We'll examine some work around housing insecurity and then discuss some of the other efforts in other areas that we have. Next slide. So the next few slides, I think there may be a delay in the slides, but the next few slides sort of depict what we determined we wanted to look at. So at the end of 2020, we made a conscious effort that health equity was really where we wanted to focus. And just as a reminder of what that definition means, it means that everyone has a fair and just opportunity to be as healthy as possible. That requires removing obstacles, and we know what those obstacles are: poverty, discrimination, and all of the consequences that come along with it: powerlessness, lack of access to jobs and pay and quality education and housing and safe environments and healthcare. And as a health plan, we decided we wanted to work and begin to work and continue working on how we remove those obstacles. Next slide. is probably my favorite slide, and I think everyone has seen it. And it's the graphic, and I'm not sure what the delay is, but it's the graphic of where you see someone at a baseball field. There are two people. The first one talks about equality. So you each give them the same number of steps to stand on. Then we talk about moving to equity, because not everybody needs the same items. And we've learned that, and we're going to talk a little bit about that. Then we talked about liberation, that is removing the barrier. So County Care is really working toward liberating our members from all of those inequities that we know exist in healthcare. Next slide. And to that end, we decided to take an in-depth look at what our membership looks like. We looked at primary care visits. We looked at where they are in terms of inpatient hospitalizations and ED visits, because we know if we can impact those three areas, we can make a significant impact in where our members are. I'm just going to go from my slides just to keep moving. On the first slide you saw, these are the areas where we focus. So what we found is that because we know everybody needs healthcare in different ways, these are the DIA or disproportionately impacted areas. And so we have started looking at how we impact our members at a zip code level, because we know the Lincoln Park is very different from Inglewood, and we'll have to impact them differently. Next slide. You saw the slide that Aaron presented.
Hello?
Yes.
Dr. Collins?
Yes.
I'm going to try to pull up the file another way, because there is a delay and I don't know what the problem is. So give me 1 minute.
No problem.
Just 1 more minute. It's loading. Okay, can you see the file?
Not yet. On my side, I still see a spinning circle.
I can see it on my screen.
Yeah.
Now it's up. Debbie, can you advance to slide 7?
Okay. I'm on 7, but I think it's a network problem. Let me go back to the original way I was doing it. Maybe that'll work again.
As we wait, this is Director Harrington. I just want to make a comment and an observation, and want to commend the system, Cook County Health System, and Dr. Collins for taking this on. But also want to point out a quote that my former boss, Dr. Terry Mason, used to use all the time. It's from Edward Deming. He said, "In God we trust, all others must have data." And so I applaud the county for actually having a data-driven approach to the issue of equity.
Thank you.
All right, can you see the slides?
I can see, it looks like you're on slide 2, at least on my end.
Could we move forward with the report and hope that the slides catch up to us?
Yeah. Absolutely.
You bet.
So, yep. I can continue talking. So you saw our COVID slide. What I also have in the slide deck is really that focus on that DIA zip codes. And so what we know about those zip codes are in those areas, those are members that are 20% below the poverty level, and also the vast majority, 75%, also have reduced lunch programs. And so we know that that's a very needy community. And when we look at vaccine strategies, we now know that about 141,000 of that population has been vaccinated. So again, continuing to work at the zip code level on that. The next few slides you'll see is the work we have done in terms of identifying what is the impact on our membership by zip code. And so unfortunately, we know that 80% of our county care members, and so that's of our 325,000 members, which is 80% of our population, live within those zip codes. So we know they have a lot of need. When we looked at ED visits in an attempt to see if we can get people out of the emergency room, where would we put our focus? We found that, no surprise, that the west side of Chicago and the south sides of Chicago, including the south suburbs, are the areas that are biggest hit. And we've identified the 60644 and 60624 on the west side are probably the most hit. And so as we look at urgent care services for our members and PCP visits, those are areas that we know we have to focus on. We then looked at inpatient admissions in terms of, do we have access for our members in terms of facilities where they can go to get care? And the eastern part of our county is the area where there's the greatest need in terms of where we can put our efforts as we look at micro centers. And we then identified the top 10 zip codes that have those access issues. And then lastly, we looked at PCP visits, because really if we can get the member in to see the PCP, not only will we hopefully keep them out of the hospital and keep them out of the ED, we can also work on some of those other measures that I'm going to talk about in a little bit. And again, that opportunity lies primarily in the southern part of Cook County. We then took another step and said we were given access, all of the MCOs were given access to Metopio, which is a database that allows you to see various components around social determinants. We took that database and we looked at that database. It's a data-driven tool that takes data from 400 other sources of information and allowed us to target planning. Slide 12, if you can get to 12, Debbie. And so when we look at that data from Metopio, we can look at COVID vulnerability, we can look at high school education, we can look at food insecurity, we can look at poverty, we can look at rental assistance and internet. And what we also did with that data, we then said we want to be able to incorporate all of the data to create our action plan. And so we took that data from Metopio and we were able to say, what area from that data is integrated and focused in terms of what we're already working on. And one of those was rental assistance. We identified 4,006 members that reside in zip codes that have the highest rental assistance priority index. And why is that important? Next slide. And why that's important, because as we look at our housing strategy, we know this is the population that is at greatest risk potentially of an eviction. So if we're going to look at housing efforts to sort of prevent eviction or early intervention for eviction, these are zip codes that we can work on. We also know that this is the population that's less likely to see their PCP. So it gives us a lot of information at the zip code level. We then took that data and we incorporated our own and started to develop our own health equity dashboard. The slides aren't slow, but when we get there, you'll see that we are able to splice that data based on all of those factors we talked about in terms of social determinants of health. We're able to splice it on our CMEs. We're able to splice it on whether or not it's a DIA zip code or not. We're able to splice it on race and zip code. So when we look at it, we are able to take all of that information and really do a zip code analysis of where our members are and what they need. And so as we looked at it, when we take that example of rental assistance, we've identified our top 10 zip codes, 60629 being the most affected area when we look at that. The next area that we then said we needed to focus on were our Hfs Pillars. And Hfs also has made a conscious effort to focus on equity. Those pillars include behavioral health, both adult and children. How quickly are we getting our members in for follow-up after they're hospitalized? Maternal and child health, And then the equity pillar, breast cancer screening, cervical cancer screening, blood pressure control. And then lastly, how quickly are we transitioning members from facilities back into the community? So when we got these 5 pillars, we decided that we really wanted to be intentional in terms of how we move forward. Next slide. We created quality improvement committees for each of these groups. Within that, we had leaders within the health plan that are staff members, and we also had executive sponsors. We then said, how do we want to focus this particular initiative? We know equity is important. We have the data on zip codes. What are the other issues and areas that we need to focus on? So for each of these parameters in terms of our pay for performance measures, we did a fishbone analysis. We did a brainstorming session of what is it that we think are the barriers for our members getting into care. So is it provider capacity? Is it outreach? Is it housing? Is it literacy? Is it communication? Is it culture? Is it COVID-19? And after that brainstorm, we said, which of those can we sort of lump together to determine how we move that effort forward? So social determinants of health is indeed one area, but we identified that access is also an issue. And there are some system issues that we all have to overcome if we're really going to make a difference in terms of how we move social determinants and how we eliminate healthcare disparities. We then have 2 examples of where we actually put that into action. Each month, we give our provider organizations and our CME organizations a report card. So at no point should they ever tell us that they don't know where they are in terms of meeting our healthcare metrics. So we tell them where their grade is. We tell them how many members they need to reach target. And so we work with 2 of our provider groups to actually focus on those DIA zip codes. One decided they wanted to focus on 60619, which includes Burnside, Calumet City, Chatham, Grand Crossing, and then 60628, which is Morgan Park, West Pullman, Longwood. We actually did a phone outreach to members who we had identified that had gaps in care. We offered them transportation where they needed it. We actually scheduled their appointments. And there was follow-up after those appointments to actually ensure that those appointments happened. And so what we found just from July to the point where we started the initiative in August and our follow-up in December is that each of those metrics that we followed on, being PCP visits, breast cancer screening, and cervical cancer screening, we were able to move the needle on improvement in those HEDIS measures so that we know that works. We also wanted to do a sense of community engagement. We wanted to get out into the community so that our members could see us and we could see them. So we then partnered with a second provider group, which happens to be within our Cook County Health System. We again identified where they were in terms of parameters. We decided that we wanted to focus on those equity measures of breast cancer and cervical cancer screening. We again made calls, arranged transportation, allowed incentives, and we did a mammogram health extravaganza at Provident in October. It was on a Saturday. Members liked it. But the really success of that community engagement is that we were able to close gaps. We completed 22 mammograms, 14 pap smears, 13 PCP visits, and 6 COVID vaccinations. But more importantly, we improved engagement, not only engagement with our staff, but also engagement with our members. And just a few member comments, which I think always hits home, is that our members like getting all of their services done at one time. We had members who had been waiting 6 months because of the pandemic, and then we called and said we could actually get your mammogram done on this Saturday. And then they were glad they were offered on Saturday. So what did we learn from that? We learned that members really don't like multiple visits. So the more we can do in one visit, the better. We also learned that access is indeed an issue. We have to have providers that are willing to see our members in the evening and on the weekends, because 9 to 5, they're generally at work. So although a small event, we learned a lot. And our goal is that over this year, we'll be able to do multiple of those with multiple partners. We then took all of our members that are in our care management entities and did an analysis of what is it that they need to help us further inform where we would have our actions. We did that for both our adult population and our child population. And we found that 10% of both populations really need help with food, clothing, and shelter. And transportation. So as we look at that becomes our areas of focus. When we look at housing insecurity, the health plan has decided that we want a housing program. We just don't want to work at housing a member here or housing a member there. We really want to look at what does that look like along the continuum. And so our program, as we continue to develop it, will look at a portion of prevention. How do we prevent eviction? How do we divert when we know members are being preparing to be evicted? How do we get the legal system involved? Crisis housing, how do we bridge them so that they don't have to go from their apartment to a shelter? Medical respite, which I'll talk about a little bit, and then really permanent supportive housing. But more importantly is how do we create for them an access to income? Because we know that it becomes a vicious cycle if we don't. So really looking at how we work on employment programs and then connecting those members who could have additional services in terms of finances to those services. Next slide. Medical respite, just at a glance, if you're not aware, medical respite there are 136 programs in the United States. We as Cook County Health have a medical respite program in Oak Park. And when we look at all the data, we know that it decreases the length of stay, it decreases emergency room visits, it decreases inpatient admissions. So we continue to be an investor in medical respite because we know for our members, it's just one additional avenue to keep them off of the street and not being housing insecure. Next slide just shows for our medical respite center in Oak Park. You can see that County Care has been the largest funder. You can see that 40% is County Care. We used all of our pay for performance withhold, and we reinvested into the medical respite center because we believe that will make a difference in terms of our members, not only in their care as they transition, but also that gives us an opportunity to also know where they are as we try to get them housed. Next slide. We have invested $5 million into the flexible housing pool. That gives us an opportunity over the next 5 years to house 66 members. When that next slide comes up, you'll see that we are a little bit almost halfway past our goal. We have now 35 members housed. So we are really excited about that and looking at how we evaluate that. There have been other programs that have, again, shown decrease in hospitalizations and ER visits. We're working on how we evaluate our members that are in the flexible housing pool so that we hopefully see that same kind of data. We are now entering phase 2 of an Advancing Health Equity Learning Collaborative. That is where the MCO partners with HFS and a community organization. Ours happens to be the Centers for Housing, along with Cook County Health and Access. And our innovative project around equity happens to be housing. So as we house members and wrap them with tenancy supports, are we able to make a difference in keeping them housed and also on their health outcomes? Food insecurity tends to be another big area where we know our members need help. As we looked at our data, we now know that 60620, 41% of our members in that community are food insecure. And so as we talk about initiatives around food, we can actually get to the zip code level. Exactly, that slide there. And we know the zip codes that are most affected. We know the number of members that we have in those communities. And so when we talk about mobile food missions, we can actually go into those exact communities and provide that resource. Next slide. So we've done a lot of that. We've done fresh fruit trucks. We've done food as medicine. We've done prepared meal delivery. We've done home delivered meals. But we want something bigger because we know there are so many other members that are infected. So we're looking at food insecurity programming. So nutritionists for those members that have those high risk chronic conditions. So high blood pressure, diabetes, hypercholesterolemia. We want to teach our members how to read food labels and really look at alternatives because we also know that the vast majority of these members live in food deserts. So we can't expect that they're going to always have access to fresh fruits and vegetables, but can we teach them the alternatives? So if you have to buy a frozen food or a canned vegetable, how you make that as healthy as possible. Also, education on SNAP benefits. We were really surprised at the number of our members who would qualify but don't have SNAP benefits. And then, are there other food subsidies that we as the health plan can provide? We provide over-the-counter cards for various household goods. Can we now provide those same resources for food subsidies? So those are what we're looking at as we move into 2022. And I'll close with the justice involved population. I think we know the data, but when we look at that population, there's definitely an equity component. When we look at those that are incarcerated, we know that that population is vastly the Black population. If you look at that last graphic, you'll see that when we look at 2010, 2,000 Blacks were incarcerated compared to 200 whites, 400 Hispanics, and 800 Alaskan Natives. So we know that there's a disparity there. So there's a lot of work to be done there. We also know that that population has a high amount of behavioral health and substance use disorder. Why would we even care about that? So we know that our system takes care of those members while they're incarcerated. Next slide. And we've been given the opportunity since April of last year to take care of them once they're released. Because of our quality metrics and how well we had done the years before, anyone that's released from the Cook County Jail who's completed their application for Medicaid automatically comes to county care, which makes complete sense. We took care of them while they were detained. We can take care of them as we transition them back to the community. And now as we begin to learn what those needs are, we can begin to focus wholeheartedly, even before they're discharged is what we're getting to, that we are able to connect them to primary care providers within Cook County Health. We're able to get them the behavioral health services they need before they're released, so there are no gaps in care. So a lot of work are done also around this population. And lastly, where do we go next? We're looking at equity training for all of our staff. We want all of our staff to be sensitive as they're talking to members and really the community in general. We're working diligently to identify those that would be able to qualify for the business enterprise program and getting them enrolled. I'm happy to report we now have 4 pharmacies that were not in that program prior, that we've worked really well to get enrolled in that program. We're looking to obtain our own director of equity that can work on this program with us. We're looking at a health equity accreditation for the health plan. We'll continue to develop our racial equity dashboard. And we have a member demographics campaign where we really want to ensure that we have not only race and ethnicity and language data for our members, but also gender identity and gender orientation so that we can address them appropriately. And lastly, and important in a lot of ways, we're beginning to look at how can we provide provider incentives around equity, because we know the work is being done, but how do we compensate those providers so that they do it more? So just a little snippet of what we at County Care are doing around health equity. We hope next year this time we have done double of what we've done now, but we're very proud of the work we've done. Thank you for the opportunity to present, and I'll be happy to take any questions if there are any.
Thank you, Dr. Collins. I know you summarized a very comprehensive program into a tight presentation for the board. I see Director Harrington.
Yes, I don't know. I have a question, I guess, in the sense that I'm very impressed with what you've done, what's going on. My question gets back to this issue of metrics and data. And is there data to actually link some of the efforts that you've undertaken to better health outcomes, which may be a stretch? And I know we do patient satisfaction surveys. Is it possible to link this to see if there's a potential increase in patient satisfaction moving forward?
Absolutely. There is clear data that directly links food insecurity and housing insecurity to health outcomes. We know that with food insecurity, if you provide access to foods and education on foods, not only are members more empowered, but their high blood pressure, their diabetes, their cholesterol, and their weight are also better controlled. We've actually seen some of that in a self-management program that we currently have around high blood pressure, diabetes, and obesity. So we know there's definitely data there. Some of the data around housing I showed, but clear data that if you can get members housed and permanently housed, we see all of the decreases around hospitalizations, ED visits, and better control of their medical condition. So absolutely data out there. Patient satisfaction, each year we do have a patient satisfaction survey of the health plan and also all of the providers that are in our network. This was the first year we actually asked questions around equity. And so that will help us to inform how we work on our cultural competency training. We're actually now looking at an initiative with March of Dimes, not only around maternal and infant mortality, because we know that cultural competence, there's a direct connection there, but we really want all of our providers to be culturally competent. We know patients are much more honest and feel much more secure with providers that look like them and also are able to relate to them. So lots of data around all three of those. Absolutely.
Okay, thank you. So I would suggest, if you haven't already done it, to establish a baseline where we are and move from that point to show some progress. And some of the things you're talking about are very intractable and been long-standing, so it may take a while. So you can let us know how long you think it'll take you to show some level of improvement, because these problems have been in place for hundreds of years, not just a few months. So.
Yeah, and for housing as an example, we think really it's a 3-year point to get to where we are able to gather that data and actually see the outcome of the work done. And so I think this is the first year where we said we probably need to look at what are our short-term goals and then what are our more long-term goals around each of these areas of equity. You're absolutely right. Nothing's going to change overnight. It's going to be a slow, steady process.
Thank you.
Director Kim.
Dr. Collins, first of all, thank you for this amazing work that you're doing. And I'm sorry we couldn't see all of your data, but I think this is really, really enlightening. So I have several questions. One, we must be a Illinois Breast and Cervical Cancer site, and I'm wondering if we always fill all of our designated slots. Do we have a patient navigation program, and sort of are we measuring that? And I think maybe most importantly, who's funding this work, and is there research being done with some of these interventions, which is, I mean, the ability for you to collect the data and link it is really robust. And I feel this is screaming to be funded through many federal agencies, foundations, and there may be lots of opportunities.
So I'll start at the end first. So there definitely is a lot of funding that's available. The vast majority of how we funded our programs has been internally. When we look at our HFS metrics for how well we do and which metrics we hit, we get a portion of that money back to exactly what we're doing. Reinvest in the community. But I would absolutely, there's definitely more money out there. So the vast majority has been funded internally. Navigation, there are some of our sites that have patient navigators as part of the transformation grants from HFS. That program is increasing. There's lots of data around for this particular population, the importance and need for patient navigators. So definitely an area where lots of work is being done. At the health plan level, probably what equates to a patient navigator are our community health workers. And so our community health workers that come from those communities where our members live, help our members navigate those, the medical services that they need within those communities. But definitely more funding being put into patient navigators as part of just about every transformation grant that we're a part of. And then ICBP, not sure if Cook County Health is a member of that, so I can't address whether or not appointments are being made. But excellent question. We've had some discussion around some funds that the facility was given from Bears Cares in terms of doing exactly that. How can we identify those members that need mammograms and pap smears and getting them in? But can't address, unfortunately, ICBP. I don't know if Strozier or Provident is a site. I would imagine so, but can't address that.
Thank you. Are there, and then really quickly, sorry, are you thinking of looking at colon cancer screening as one of your quality metrics? We certainly know there's huge disparities there.
Absolutely. So it's been a part of the Medicare metric all along. This will be the first year that colon cancer is brought back into the Medicaid population. So we actually had a discussion around colon cancer on yesterday in terms of how we identify members. But more importantly, we know the hesitation that especially the community of colors have around colonoscopy and really using the benefit of Cologuard, which tends to be less invasive, and how we are looking at strategies of how potentially the health plan can meld those out and have them meld back into providers. So yes, colon cancer is an initiative that was added on this year. And definitely
thank you. Thank you.
Thank you.
And I will just add to Dr. Collins' statement that we are working very closely with the county, ARPA, and different funding strategies to be able to bring new innovative programs in both the housing, mental health, and food and nutrition space across the county. And so look forward to giving more updates on those exciting programs as they start to get put in process.
Well, thank you, Dr. Collins, Mr. Galiner, Mr. Rocha. I think that concludes the Managed Care Committee report. Our next scheduled meeting is for Wednesday, April 20th at 10:30. And since there was no meeting this month, we have no motions.
Thank you.
Thank you.
Thank you for the very, very extensive report. We really appreciate it. Next, Director Guggenheim will now review the Quality and Patient Safety Committee meeting minutes.
Yes, good morning. The Quality and Patient Safety Committee met on Thursday, the 2nd of February at 10:30 a.m. We received the following reports, which are included in the minutes. The High Reliability Organization Dashboard, which covered metrics in the following subjects: the 30-day readmission rate for Strozier Hospital, the case mix index for both medical and surgical, MS and DRGs, the top box score recommendation of the hospital, and the report on the HbA1c for diabetic patients. In a regulatory and accreditation update, we learned that we have submitted to the College of American Pathologists the updated citations action plan, and we are awaiting their final report. And the virtual survey for the Strozier American Burn Association re-verification evaluation has been completed, awaiting final report. Upcoming surveys in 2022 is the College of American Pathologists survey at Provident, and that's now pending. And there will be a Strozier trauma designation survey in June 22, and a Strozier stroke certification survey between July and December sometime in 22. And more importantly, I think, than all these things, there is now a newly created system continuous survey readiness committee that's scheduled to launch in 22, so that impending Joint Commission surveys will be less of a crisis management and more of a thing for which we are on continuous readiness. We received a report from the HEDIS HRO work group, and also an update that was very illuminating from Dr. Kimberly Dixon, the section chief on geriatric medicine, on what we have in the way of geriatric services. I think this was news to most of the members of the committee and those who were attending the meeting. We were also introduced to the Chief Experience Officer, Lynn Dang, who talked about her previous experience and what she was hoping to do in the area of patient experience. Dr. Akintorin from the medical staff presented items for the committee's consideration, and also presented the Strozier Hospital medical staff appointments, reappointments and changes. And we also approved the Provident Hospital medical staff appointments, reappointments and changes. We went into closed session for a report on safety issues, but that information is not going to be re-reviewed at the board level. So the minutes are here presented for the board's consideration as part of the combined motion to be made later in this meeting. And the next meeting of the committee will be held on Friday, the 3rd of March. I'm sorry, Friday, the 18th of March at 10:30 a.m. If there are any questions arising from the minutes, now's the time to ask them. That concludes my report.
Thank you, Director Guggenheim. Next, Director Ryder will review the Finance Committee meeting minutes. Director Ryder.
Yeah, hi, I just want to make sure everyone can hear me okay. Is that good?
It is good on my end.
All right, great. Thank you, Mr. Chairman. The Finance Committee meeting met on Thursday, February 17th at 9 a.m. Next meeting of the committee is Friday, March 18th at 9 a.m. We're not planning to have staff re-review reports, as you've heard from the other committees, and reports and contracts from the meeting. While you're reviewing the minutes, Deb will have a slide reflected with a list of the contractual requests greater than $1 million. If any additional questions are raised, Charles, Pam, and staff will be present and ready to address. Action items included in the minutes. We conditionally approved 28 contract and procurement items. Numbers 8, 12, and 14 are pending review by contract compliance. On the screen, you'll see the contractual requests from the Finance Committee meeting whose fiscal impacts are greater than $1 million, which are highlighted for your information. And of note, during the review of request number 1, the contract with via Workforce Solutions, LLC, which was formerly Vizient Incorporated, for contract management and nurse registry services, Dr. Bina Peters provided details on what the additional funding will cover, and Dr. Peters and Valerie Amos provided information on the efforts to improve hiring, recruitment, and retention of nurses. We received and filed Cook County Health Grant Award related items. We approved a proposed transfer of funds. And the committee also received the following reports, which are also included in the minutes. A report on our MBWBE metrics. One emergency purchase was reported, and we received a report from our Chief Financial Officer, Pam Cassara, on the December 2021 year-to-date financials. The action items, reports, and presentations from the committee, again, are included in the meeting minutes. If there are no other questions on the information, the minutes are being presented for the board's consideration as part of the combined motion to be made later in the meeting. And Mr. Chairman, I will avail myself and staff of any questions that folks have regarding anything that occurred at the Finance Committee meeting.
Thank you. We have one question. I see Director Curry.
Yeah, it was a statement. The form is back up now. As he was speaking and presenting, I wasn't able to see the information he was referring to. It is back on the screen now.
Okay.
Well, now that it's up, we'll pause for a second to see if any other directors have any questions as they review, or anyone else has any questions.
And we had very good turnout at the committee, and I thank members of the committee and the board for attending our meeting last week.
Okay. I have no questions. Thank you for putting it back up.
Thank you.
If there aren't any questions, Mr. Chair, that's all I have.
Thank you. Thank you. There are no contracts being presented directly for the board's consideration today. So if there are no other questions before the board acts on resolutions, minutes, and action items contained in the minutes, can we move on to a combined motion? We can move on to a combined motion, I'm sorry. I'd like to entertain the following combined motion. It's lengthy, to approve the following. Item 4A, resolution honoring Dr. Connie Mannella. Item 4B, resolution honoring Dr. Suja Matthew. Item 5A, January 28th board meeting minutes. Item 5B, minutes of the Human Resources Committee meeting of February 17th, which will include the proposed collective bargaining agreements, including economic packages, wages increases, and healthcare negotiated between the County of Cook and the International Union of Operating Engineers, AFL-CIO Local 399, and the House Staff Association of Cook County, representing all postgraduate level physicians and dentists, including interns, residents, and fellows. Item 5D, minutes of the Quality and Patient Safety Committee meeting of February 17th, which include the Strozier and Provident Hospital medical staff appointments, reappointments, and changes. And item 5E, minutes of the Finance Committee meeting of February 17th, which include the contracts and procurement items, grants award related items, and transfer of funds.
So moved.
Do I have a
second?
Thank you. The combined motion has been made and seconded. Madam Secretary, please take the roll call vote on the combined motion.
Roll call vote on the combined motion. Aye or nay, Director Curry?
Aye.
Vice Chair Deere?
Aye.
Director Garza?
Aye, with the exception of item 16 under the contracts and procurement items. which I'll abstain on that item.
Director Guggenheim?
Aye.
Director Harrington?
Aye.
Director Kim?
Aye.
Director Keding?
Aye.
Director Munar? Director Munar? I will skip back to him at the end. Director Prendergast?
Aye.
Director Ryder?
Aye.
Director Story?
Aye.
Board Chair Taylor?
Aye.
And returning back to Director Munar, are you with us? It appears he's present, but maybe he's having sound issues. Director Munar? Okay, Chair, we have 11 yeas, 1 absent, and the abstention from Director Garza on request number 16 contained within the Finance Committee minutes.
Thank you. The ayes have it. The combined motion carries. The next item is my report, which will be brief. I'd once again like to give thanks to and our appreciation to Dr. Mannella and Dr. Matthews for their excellent service. We really appreciate it. So we'd like to reiterate that. As on the next after me, Mr. Rocha will highlight that we are about to embark on our strategic planning process for CCH. This is an important exercise for this organization, and I look forward to the active and full engagement of all of the stakeholders, from the board to our community partners. And we look forward to all of your input and know that we will take that into consideration as we develop the strategic plan. Mr. Rocha?
Hi, thank you again, Chairman Taylor, and good morning, everybody. I'm actually going to start by having Andrea Gibson, our Chief Strategy Officer, go through our strategic planning process where we are and provide an update to the board. And so with that, I recognize Andrea Gibson.
Good morning, everyone. This is Andrea Gibson, Chief Strategy Officer. I think last month, Israel in his CEO report previewed that we would be starting our strategic planning process this month. And our focus initially is really to get stakeholder feedback to help guide us on our strategic plan development. And I'll actually request control here. We'll see if I can make that work, Debbie. Okay, so we're looking at a little bit of a whirlwind of meetings to get feedback from employees, community members, our labor partners, and we have also these community advisory boards in some of our affiliated with our health centers, and so we want to get feedback from them. We also are working to establish a time for feedback from the Board of Commissioners. And so from a process perspective, we'll have these meetings and ask people to fill out surveys on our strengths, weaknesses, our opportunities and threats. And we'll be establishing a special meeting of the board of directors to go through that feedback and see what direction that kind of puts us in, and open it up for discussion from the board. So what I wanted to do today is I wanted to walk through what the calendar was and the process, but also share with you what we would be using to guide discussions in these meetings that are coming up. And so I'll go to the next slide. let's see. So this is the presentation to stakeholders. We find that it's useful to remind people of who we are. And as part of that, I think certainly you all know our mission and vision, but to remind people that this is the foundation of our organization. And also remind, I think some people see parts of our system and don't always look at it from a whole, but we're certainly we have multiple components. We're a provider of care, conductor of research, provider of coverage, steward of public health, and we also, have a graduate medical education program that is critical to our identity. So we're also going to remind, I'm sorry, was there a question? Maybe that was just an echo. Remind people what we do. We serve over 600,000 individuals. When you combine the health system and the health plans on an annual basis, we have 850,000 outpatient registrations annually, significant number of prescription filled at 1 million. Of course, our emergency and trauma visits are at around 100,000, and we have over 30,000 intake screenings at the Cook County Jail. And finally, 40,000 visits to the Core Center. So this is a little bit dated at this point, but it stands up. We provide most of the charity care in Cook County. And so this is from 2018, but it shows the significant portion of charity care and really underscores our mission. So looking at our patient demographics, you can see that the majority of our patients are between the ages of 21 and 60, 30% are over 60. And just looking at the ethnic, gender, and race breakdown, I think this is all familiar to you in terms of our patient population. So also we're going to remind the stakeholders that we're not just Strozier, that we have Strozier, Provident, and health centers, and the jail locations, public health locations throughout the county. So, we thought we would highlight also what we've been doing during the pandemic, because it has been such an important function for us as we serve our populations. So it's really been supported, our response to the pandemic has been through being a provider of care, but also through the Department of Public Health. And through making sure tests are administered and treating patients with COVID, as well as we're approaching having provided 1 million doses of the vaccine through a variety of locations. For public health, contact tracing has been a focal point, as well as helping businesses operate within the pandemic and conduct mitigation, distributing doses of the vaccine to partners and to Cook County, and also helping organize the hyper-local pop-up sites and distributing additional vaccine. So as we look backwards before we look forwards, these are some notable accomplishments that we have talked about in this forum before to help support the mission of the organization. I'm not going to go through each one in this venue, but these are some of our recent accomplishments. So there are a few board members who have participated in the last one or two strategic plans. The strategic plan for Impact 2020 focused on 7 areas that are listed here. The Impact 2023 focused on a little more consolidated focus areas. What we're going to do now is get strengths, weaknesses, opportunities, and threats feedback from our stakeholders to help develop what our focus areas will be for the next 3 years. And so that brings us to an assessment of our current state. Oops, I went too fast. So as I mentioned, talking about what do we do well, what are our weaknesses, where do we have opportunities, and what are our threats. So we will go through each one of these. And remember that we will be providing a survey tool that will ask a lot of these questions. So if individuals do not vocalize their thoughts immediately when we go through this during the sessions, they'll have an opportunity to share with us through the survey. And so we just pause on each one and see if we can generate some feedback. And certainly the board is welcome to provide feedback now. But our thought was that when we have our special board meeting on the strategic plan after we've gathered the information from the stakeholders, that we would use that as the platform for further discussion. We'll also ask some of these questions. What should our highest priority be in the next 3 years? What services are needed? What are we doing well, not so well? How do we treat patients who come from different backgrounds? And talk about what is our competitive edge in this market, if any, and what programs and services do we offer that set us apart, and how do we play a role in terms of advocacy for more access to healthcare. So these are some of the areas that, we thought, well, what should our focus be going forward? Is it some or all of these as the main big things that we should focus on? Patients, employees, facilities, our processes, equity, our systems, supplies. I don't need to read them all, but what is the burning platform for the next 3 years? What is the most critical thing for us to be focused on? Or is there something that's not listed here that should be part of what we fold into all of our work over the next 3 years? So with that, I'll stop and see if there are any questions about the process, or even if there is any immediate feedback on our strengths, weaknesses, opportunities, and threats. So more to come. Chair Taylor, I think the discussion will really be generated, I think, by reviewing feedback from our various stakeholders. So thanks for your time this morning.
Thank you. Mr. Rocha?
Thank you, Andrea. And so now, Board, we will go to our divisional reports and wanted to share some highlights from our main divisions throughout our organization for this month's report. So we'll start with ambulatory care. For January 2022, we are excited to have some highlights for the board. Cook County Health Ambulatory Services was selected by America's Essential Hospitals to present at their national conference, Vital 2022. The presentations that were selected were the Compassionate Journey, looking and focusing about our care and what we do in our clinics for our patients, and the Community Mass Vaccination Program, on how we were able to give over 1 million vaccines throughout the Cook County area. Our Patient Support Center answered more than 41,000 patient calls with an average answer speed of 60 seconds or less. We completed insurance verification retraining provided by the Revenue Cycle Department for all scheduling staff. Our newly merged COVID-19 testing and vaccination call center answered more than 12,000 calls in this two-month period. Our primary care community sites will begin co-payment and collection training as part of our concerted focus area on improving revenue capture and compliance. We are working to reduce our specialty care backlogs by removing duplicates and patients that have already been seen, adding new patient access for advanced practice providers, rewriting Cerner triage rules to move patients that are not needing in-person visits to e-consult. To continue addressing access matters, our specialty care team is focused on optimizing the use of advanced practice providers, maximizing e-consult services for several specialties. The specialty team is providing with our patient support center to fill vacant slots and opportunities for patients to self-schedule with services for immediate access. We have seen great improvements in GI, our hand orthopedics, general orthopedics, and hematology by being able to provide these services. Making sure that our patients have immediate access to the specialty care they need is the best thing that we can do to provide access to our patients, and these efforts reflect the work that is being done to ensure time of access to provider. In COVID-19 updates on our ambulatory care division, the last day of operation of our reopened mass vaccination sites in Matheson, Forest Park, and Des Plaines was February 13th, 2022. In the 4 weeks that we were open, we administered 15,713 COVID-19 vaccinations to community members. One of the great lessons learned was that we began giving away $100 gift cards as part of a comprehensive program to increase vaccination rates. This was built on part of our equity strategy. It is important to recognize that some individuals do not have the availability to take time off from work or to be compensated for the time that they take away from work to go get vaccinated. We distributed the first 250,000 worth of gift cards in less than 1 day to patients at the mass vaccine sites throughout our community health centers and at Strozier and Providence hospitals. The week before the card promotion, we saw an average of 400 people per day across all Cook County Health's 15 sites offering vaccinations. On the first day of the promotion, we saw approximately 2,500 people. Despite having exhausted our gift card supply, the next day we saw nearly 1,700 people at our 3 mass vaccine sites alone. We were thrilled with this response, and this helped us to understand the positive impact that incentive programs can have. We also want to highlight that of these individuals who came in the first 2 days, the 2,500 and the 1,700, 44% of the vaccines administered were for first doses. And so it was really effective in helping to get those individuals who were hard to reach in the original doses of the vaccine. And we will continue to look for opportunities to be able to help individuals reduce those barriers to access to care and provide availability to come and get vaccinated. Strategic opportunities and challenges in our ambulatory care division going forward. We continue to, across all our divisions, to increase access to oral health. We are focusing on patient access and volumes by reviewing all appointment templates, slot utilization, and no-shows. We received equipment in early January, enabling our Cottage Grove and Robbins community dental clinics to go to digital radiographs. We expanded elective surgeries at Providence by adding an additional full day of block time to better serve our patients. We are working on a project proposal to form a limb salvage program in clinic, and we are working with our human resources to prioritize hiring needs across our ambulatory care division. Any questions on our ambulatory care division report? All right. Hearing none, we will go to our CIRMAC Health Services update. Our strategic highlights for January 2022. We have ongoing patient vaccination efforts going on through our CIRMAC campus. From February 2021 through January 31st, 2021, that was February 2022. From February 2022 through January 31st, take that back. From February 2021 through January 31st, 2022, 14,897 COVID vaccination doses have been dispensed. Current vaccination rates of active patients housed in the jail are 64% have received at least one dose and 54% have received 2 doses. Preparation for the National Commission on Correctional Healthcare Accreditation continues. Survey is expected in 2022. JTDC reaccreditation survey is also expected in 2022, and our team is working to make sure that we are fully compliant, prepared, and ready to do an excellent job for those reaccreditation surveys. Strategic opportunities and challenges for January 2022, increase in jail census. Trending suggests that for 2022, our average daily census will be in excess of 6,000 detainees. Transfer to the Illinois Department of Corrections has stalled again with more than 850 detainees remanded to IDOC remaining at Cook County Jail. COVID protocols, testing, and vaccination remain critical strategies to mitigate and contain COVID jail and ensure a safe population. Any questions with our CERMAC health update? Right. Hearing none, then we will move up to the Cook County Department of Public Health update for January 2022. To date, CCDPH's mobile program has administered more than 47,675 vaccines at more than 1,257 locations. To date, CCDPH has partnered with providers to complete 4,223 in-home vaccinations. To date, CCDPH has distributed 361,640 Binax Now tests to organizations and individuals, and has distributed thousands of KN95 masks to CBOs, FQHCs, and municipalities. Non-COVID related strategic updates from CCDPH. CCDPH Opiate Overdose Prevention Team updated 2 resources for community stakeholders. A research brief that summarizes the research evidence on overdose prevention sites, and an opiate Shiny app with 2020 overdose mortality counts. The research brief will be shared on the Cook County Department of Public Health website, as well as the Shiny app. Opiate data in the Shiny app is available by municipality. Registration is now open for the 17th Annual Chicago Food Justice Summit that will be held virtually on February 23rd through the 25th, 2022. The theme of this year's summit will be Collective Care, highlighting, in the face of global pandemic, neighbors, mutual aid networks, cooks, and local growers can come together and show up for each other. CCDPH is partnering with the Chicago Food Policy Action Council to plan this year's event, which will include a panel on Cook County's Good Food Purchasing Initiative. You can learn more and register at this year's summit at www.chicagofoodpolicy.com/Chicago Food Summit. Routine inspections. The Cook County Department of Public Health conducted 50 nuisance complaints. They responded to routine inspections. They had 50 routine inspections. Nuisance complaints, they responded to 33. COVID mitigation violations received and responded to was 66. And COVID order and ticket citations issued was 2. Strategic opportunities and challenges highlighted by the Cook County Department of Public Health. New time-saving sexually transmitted infection surveillance workflow is planned to be rolled out by the end of the second quarter. Moving forward with planning for Healthy Suburban Cook County Survey, Health Atlas, and the Youth Risk Behavioral Survey is underway. Creation of a survey to access data across units at CCDPH to understand existing data streams, ongoing projects, grant assessment or evaluation requirements, databases, data collection, practices, and indicators of interest specific to each unit, and incorporated drug qualitics is underway. Chicago Department of Public Health plans to launch a We Plan 2025 within 4 to 6 weeks. Sorry, that was Cook County Department of Public Health plans to launch a We Plan in 2025 within the next 4 weeks, and working with human resources to prioritize hiring needs. Any questions with CCDPH's report? Then we will go on to strategic highlights from our Health Plan Services Division. For our Health Plan Services, due to an increase in Medicaid population...
You actually have a question, I'm sorry. Sure, please.
This is Director Herring. It's not a question as much as an observation. And I've attended the food summit in the past, and there's a direct relationship between many chronic conditions and the foods we eat. There's a term that cardiologists developed called primordial prevention, and that's prevention of risk factors. And diet is one of the major risk factors for a number of diseases. So if board members are interested in learning more, I would encourage them. I plan to attend, and I would encourage other board members to consider attending.
Absolutely. It's an innovative and fun summit, and really encourage everyone to please participate to be able to learn more and see what we can do. And just great information that is showed by the wonderful partners that come together in the summit to be able to help us learn about what we can do to make sure that we are all getting the best of our nutrition and helping others get the food that they need. Any questions or comments? Thank you so much, Director. For our health plan services, we're just reporting that due to an increase in the Medicaid population and the hold on redeterminations until the end of the public health emergency, County Care continues to experience significant growth, with membership in January 2022 exceeding 425,000 covered lives. In January, County Care was notified that it will retain its 50% auto assignment within Cook County beginning in March, in comparison with Blue Cross Blue Shield, Aetna, and Molina at 16.7%, and Meridian 0% of auto assignment. On January 31st, County Care's health plan management team transitioned to Cook County Health's own locally managed management system for care management called CMIS. This will allow us to be able to have in-house management of our patients' care management and team, and we're excited about this development. In alignment with the Healthcare and Family Services implementation of the new admission, discharge, and transfer ADT vendor, County Care established a no-cost data sharing agreement in November and completed its ADT implementation this past month with Collective Medical Technologies. As part of County Care's contract with the Healthcare and Family Services, County Care has made a commitment to invest in diverse, minority, and women-owned businesses that are certified by the State Business Enterprise Program, BEP. To meet this commitment, in January, County Care transitioned 60% of its call center volumes to PCG Consulting Group. Based in Cook County, PCG reflects the diversity of the community, with 79% of employees coming from locally underserved areas. The remaining 40% of the call center operations will be transitioned by July 1st, 2022. Claim auto adjudication increased to 85%, and there was a decrease in claims pended in November. Timeliness to pay claims continues to decrease month over month and is currently close to an average of 30 days. As of January, 33 County Care members have been placed in permanent housing through a flexible housing pool, and 3 members are in bridge housing. In 2021, over 14,000 emergency home-delivered meals were provided to members as part of Cook County's meal program due to COVID-19 pandemic. In 2021, it was identified that 4.4 thousand County Care members had visited the emergency department due to ERSD or CKD. County Care issued a request for proposals in January to select a vendor and selected a vendor to improve care management of members with ERSD, CKD, to improve quality outcomes and reduce unnecessary utilization of the emergency department. In opportunities and challenges identified by the Health Plan Services Division, opportunities for cost saving and quality improvement continue to be an area of focus for Health Plan Services in 2022. Under its medical cost action plan structure, County Care has identified over $40 million of estimated cost savings opportunities for County Care. FY 2022 across the areas it will be focused on is pharmacy, network management, medical management, and operations. There's also an opportunity for the development of an additional value-based care models and additional expansion of the County Care PCP network. County Care is continuing to implement initiatives to improve its medical loss ratio through its medical cost action plan process. Also, a highlighted opportunity is working with Human Resources to prioritize key hiring needs and structure. Any updates or any questions from our update from our Health Plan Services Division? Hearing no. Do I see a hand raised? I'm sorry. I think I see one hand. Okay.
Director Harrington, do you have your hand up? Do you have another question?
No, I'll lower it. I apologize.
Oh, okay, thank you.
Great. Then we'll move on to an update from Provident Hospital. Provident strategic highlights for Provident Hospital for January 2022 is that the ACR mammography 3D accreditation documentation was received on January 31st, 2022. ICU reopening is expected this spring, and we are continuing to offer monoclonal antibody therapies to reduce COVID-19 hospitalizations at a specialty clinic at Provident Hospital for monoclonal antibody therapy. Strategic opportunities and challenges for January 2022. The HVA system is being addressed to ensure optimal OR and procedure needs and reduce downtime procedures. General facility upgrades continue, including painting, lighting, and furniture preparation for new units that are about to open. Preparation for accreditation surveys for lab and nuclear medicine are underway. Planning staff levels for expansion of medical surgical units and the reopening of expanded emergency room procedures to ambulance runs is underway, and working with our human resources to prioritize hiring needs. Any questions on the Provident update? And then last but certainly not least, our update from John Strozier Hospital. And COVID-19 volume has declined by 80%, and we are currently at less than 25 patients average census of COVID-positive patients. That is a great hallmark from our high that we experienced earlier this week. So we want to commend our team and the community for working to bring down COVID hospitalizations together as a community effort. Surgical volumes are recovering, and we have 4 times daily throughput meetings to coordinate care, improve access, reduce lengths of stay, and reduce ER boarding times. Moving to a 4-day model huddle check-in is the new process and has been proving positive gains across our hospital for throughput. First Strozier Hospital Patient Family Advisory Council, PFAC, was held on February 23rd. This is a council that actually brings in the ability of both our patients and family and what we can do to better streamline our hospitals. We're excited to be bringing PFAC to Cook County Health, and we'll be having them throughout our organizations. Strozier was the first one, and we're excited about this hallmark moment for our Strozier Hospital. Strategic opportunities and challenges in January 2022. We are working with the county's capital planning team on wayfinding signage to go up at Strozier Hospital. Geographic localization is being pursued to cohort similar patients to make clinician rounding easier, to improve quality, and to potentially reduce length of stay is being evaluated. Geographic localization also allows for nursing certification and improved retention. Dispersing EVS and transportation employees to specific departments on nursing units to help with speed and throughput is being piloted for target expansion, and evaluating options for chaplaincy services underway, and of course working with human resources to prioritize hiring needs in the organization. Those are the complete updates from our divisional reports, and we also want to commend our media team for over 544 media placements that brought 9.1 in earned media value to our organization, with the top stories being focused on an educated front, talked about Pfizer and FDA COVID-19 vaccine for kids, mask optional policies that were discussed throughout our organizations and schools, and treatment aimed at preventing COVID-19 as those for high risk now available at some hospitals for expanded treatments. Again, thank you to everyone for the board. These are our updates at this time, and the full report is submitted for the board's review.
Thank you, Mr. Rocha. Do we have any questions from the directors? Hearing none, I believe our agenda has been exhausted for the day. May I have a motion to adjourn?
So moved.
Right. Second.
You got a second?
The relationship with Sinai, I think, is still
Someone's unmuted. Madam Secretary, can you please take the row?
Director Taylor, was it Director Ryder who seconded it?
It was me, Director Prendergast.
Okay, thank you, Director Prendergast. And you don't need to have a roll call vote unless you like it. for.
No, you don't need to have a roll call vote. Thank you. I just want to make sure we had motion and seconded. Thank you. The chair declares the meeting adjourned. Thank you all. Hope you have a great day.
Thank you.
everyone.